Today's drug is hydrochlorothiazide, brand name Microzide. The therapeutic category, it's an antihypertensive. More specifically, it's a thiazide diuretic. There are several indications for this drug, the first being edema. It's used in the treatment of edema that is caused from various sources, such as renal dysfunctions like nephrotic syndrome, chronic renal failure, heart failure, corticosteroid therapy, or in estrogen therapy. The next indication is its use in hypertension. If a thiazide is chosen over one of the preferred agents, it can be used to lower blood pressure. There are several off-label uses, the first being in calcium nephrolithiasis prevention. Hydrochlorothiazide can prevent recurrent calcium nephrolithiasis in patients with high urine calcium concentrations. The next off-label use is in nephrogenic diabetes insipidus. Hydrochlorothiazide may be beneficial in the treatment of diabetes insipidus that is of a nephrogenic nature. Dosage form, strength, and dosing. The dosage forms are the capsule and a tablet. Capsules come in a 12.5 milligram strength, and tablets come in a 12.5, 25, and 50 milligram strength. Regarding the dosing for adults with edema, you initiate the dose between 25 and 100 milligrams by mouth every day, divided up into 1 to 2 doses. The max dose is 200 milligrams per day, with the dose adjustments being based on patient tolerance and response. Dosing for adults with hypertension, you initiate the dosing between 12.5 and 25 milligrams by mouth every day, with a target dose of 50 milligrams every day. The titration is based on the patient response. Although the target is 50 milligrams every day, there is some literature that suggests the max benefit is not seen past that 25 milligram point due to adverse effects. It's important to note that chlorothalidone or indapamide is the preferred thiazide diuretic. However, this can be used in combination therapy. Now, the off-label dosing for adults in the prevention of calcium nephrolithiasis. You initiate 25 milligrams by mouth every day, and the titration is based on patient tolerance and calcium levels in the urine. The target dosing is between 50 milligrams to 100 milligrams per day, divided into 1 to 2 doses. Twice daily dosing is suggested in doses that are greater than 25 milligrams due to the drug's short half-life. The off-label dosing for adults with nephrogenic diabetes insipidus, the dosing is 25 milligrams by mouth every day or twice a day. Pediatric dosing for hydrochlorothiazide will not be discussed, so make sure to consult the most current literature. Special populations and considerations. Drug absorption is reduced in patients with chronic heart failure. Patients that are renally impaired will have higher plasma concentrations of the drug and the prolonged elimination half-life. Loop diuretics are favored in the treatment of edema, but thiazide diuretics have their place as an adjunctive agent. Cross-sensitivity of sulfonamide-derived drugs is often challenged, but should never be ruled out due to the similarity of chemical structures. Geriatric patients may see more electrolyte disturbances when using this medication. And in pregnancy, it's definitely important to note that hydrochlorothiazide does cross the placenta, and the use is not desired, and if it has to be used, it must be monitored. Mechanism of action and pharmacology. Hydrochlorothiazide works through sodium reabsorption being inhibited in the distal tubules of the kidneys. This sodium inhibition increases sodium and water excretion. Potassium and hydrogen ions are also excreted, but to a lesser extent. Hydrochlorothiazide is absorbed well in patients with healthy kidney function. The distribution for this drug is between 3.6 and 7.8 liters per kilogram. This drug is not metabolized in the typical fashion. Greater than or equal to 61% is excreted in the urine as the unchanged drug. The onset of action is around 2 hours in adults, with the peak effect being seen between 4 and 6 hours. The time to peak is between 1 and 5 hours. The duration of action is between 6 and 15 hours. The half-life elimination is between 6 and 15 hours, and this drug is between 40 and 68% protein bound. Side effects: orthostatic hypotension, bloating, numbness, constipation, diarrhea, dizziness, headache, hives, irregular heartbeat, nosebleeds, and weight loss. Drug interactions: alcohol could enhance orthostatic hypotension. Allopurinol's serum concentrations may be increased with concurrent hydrochlorothiazide usage. Amphetamines may decrease the effects of hydrochlorothiazide. Anti-diabetic agents may have decreased efficacy from hydrochlorothiazide use. Monitoring parameters: blood pressure, sodium, potassium, creatinine, blood urea nitrogen. Patient counseling information: hydrochlorothiazide can be used to treat blood pressure or edema. Patients should be aware that they may experience constipation, diarrhea, dizziness, and fatigue. Patients should be cautioned about orthostatic hypotension.